So now we're going into history. The history is when we ask the patient questions like, how did this happen? Why are you here today? If they have any pain, you ask them where it is localized. Is it acute pain or is it chronic pain? Chronic or acute can help to narrow down what the injury is. Then you can ask what type of pain it is. If it's throbbing, then it might be vascular. If it's a sharp pain, it might be a fracture. These can always narrow down what the injury might be. Then you're also going to go into what their occupation is, what they do on weekends. If their occupation is standing or sitting, that can also help narrow down what the injury is. If they play sports, you ask them in more detailed questions like what position do they play or what sport do they play. Then you ask them how often do they play that sport and if that happened to coincide with the injury. Cool. Now we're in the observation phase. The observation phase, we're going to check the physical attributes of the ankle injury as what we're supposing it is. So first we're going to start with gait, and we're going to have the patient walk towards us and then turn around and walk away. Here we're checking the equal stride length, foot position, and weight distribution. The foot should be within 0 to 20 degrees of external rotation when walking. That's to make sure, this is a test to check to see if anything is wrong with their gait. Now we're going to have the patient stand on their toes, stand on their tippy toes, and here you're going to see that the heel is going to go into a varus formation when you stand on your toes. So now we're moving on to the anterior view of the ankle. And this is the observation phase, so you're going to look at anything visually that you can see. So you're going to look in between the toes, what you can see there, if there's any sign of athlete's foot, any fungi. You're going to look at the toenails. You're also going to look at any, if there's any edema or if there's any internal bleeding like hemorrhaging. So now we're looking at the medial view, and here you're going to look for any internal hemorrhaging or if you're going to look for edema. And if the patient everted their ankle, it would actually tear some deltoid ligaments here. So you want to look for any signs of that, as well as the arch. You want to see if they have a high arch, low arch, or a good arch there. And that's about it. Now we're looking at the lateral view of the ankle, and here you're going to look for any edema or hemorrhaging. That could be signs of an internal ankle sprain that would possibly tear the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. Now we're looking at the posterior view of the ankle. The alignment of the ankle should be in a neutral position or have slight valgus. You're also going to be looking at the Achilles tendon for any edema that may be caused by an Achilles injury. You're also looking at that calcaneus to see any deformities in that. Now we have the patient in the supine position. We're going to observe their toenails for any ingrown toenails or any infections that might be occurring. We're going to also check for any bunions on the 1st and 5th digits. You're going to check for any hammer toes or claw toes and the ability to spread their toes. And look for any ulcers between your toes, between the toes as well, or any athlete's foot that might be occurring as well. Now you have the patient in the prone position, and you're looking at the plantar surface of the foot. You're going to be looking for any ulcerations that might be occurring, any plantar warts that might be occurring, or any calluses, as well as blisters that might be occurring. Now we're moving on to palpation. Palpation, we're going to look at the medial and lateral malleolus, and we're going to palpate the area. Now you're going to palpate the plantar fascia. Plantar fascia is a triangle right here, and you're going to palpate it in that form. You're going to palpate the triangle starting at the calcaneus. It may be harder with calluses to feel for the plantar fascia. Now you're going to palpate for the sesamoid bones. The sesamoid bones are found at the base of the first metatarsal. So you're going to follow the metatarsal all the way down and find them right there. And this is just to see that they're still intact and they're still there, just so you can rule out sesamoid fracture. Now you're going to palpate the metatarsal phalangeal joints, or MTP joints, to see if there's any inflammation there caused by any synovial fluid. So you can find the first one there, and you're going to palpate all of them as you find them. Now you're going to palpate the Achilles tendons. You're going to palpate these to see if there's any Achilles tendonitis occurring that may lead to a tendon rupture. So you're going to look at them first to see if there's any difference in them, and then you're going to feel them equally to compare one. Okay, now we're going to move on to the range of motion of the ankle. The range of motion in a neutral position, it should be 90 degrees. And then when dorsiflexed, it should be a 15 to 20 degree difference. When plantar flexed, it should be a 40 to 50 degree difference. When your foot is inverted, there should be a 20 to 35 degree difference than normal. And eversion, there's going to be less. It's going to be a 20 to 25 degree difference.
Posterior.
Now we're going to move on to some muscle testing. First we're going to test the posterior tibialis muscle. How we're going to test this is we're going to plantar flex the foot and have the patient attempt to invert their ankle while giving a resistive motion. If there's any pain, that might be a sign of a posterior tibialis injury. Next we're going to do the anterior tibialis muscle. While the foot is plantar flexed, the patient will attempt to invert and dorsiflex their ankle. So they're going to move it up as well as invert. And you're going to resist the patient's up and invert. There we go. And if there's any pain with that, it might be the anterior tibialis muscle. Next, we're going to move on to the peroneus longus and brevis. Foot in the plantar flex position. The patient will attempt to evert their foot while you resist the patient. So you're going to resist the patient's attempt to evert their ankle. Next, you're going to move on to the extensor hallucis longus and extensor muscles. While the ankle is in neutral, the patient will extend the great toe. And you're going to resist the patient while doing so. If there's any pain with that, it might be an extensor hallucis longus. And you can also do these with the other toes, resisting their toes as well. Next, you're going to move on to the gastrocnemius. The gastrocnemius, while the ankle is dorsiflexed, so you're going to have the ankle dorsiflexed, the patient will attempt to plantar flex their ankle. And that will cause the gastrocnemius to work, activate. And if there's any pain in that, there might be a gastrocnemius injury. Now we're going to move on to special tests in hops. First test we're going to do is the anterior drawer test. How to do this is you're going to secure the tibia, grab the calcaneus, and do a 20 degree plantar flex, and then pull the calcaneus up. Now we're going to move on to the apprehension test. The apprehension test is to test the talofibular ligaments. So while the patient is plantar flexing, you will invert their foot, which will strain the ligaments here. Now we're going to move on to the varus stress test. The varus stress test will test the calcaneofibular ligament to see if it is intact. So you're going to secure the tibia and invert the hind foot, the calcaneus, to test it. Now for the valgus stress test. The valgus stress test is opposite to the varus. You are testing the deltoid ligaments on the medial aspect of the ankle. How you're going to do this is you're going to secure the tibia and add valgus pressure to the hind foot of the calcaneus. And that concludes my ankle injury assessment using HOPS. Unfortunately, my patient died from a sudden cardiac arrest during it, which we didn't assess for because it was an ankle injury assessment. So yeah, that's a bummer, but you know, life goes on for some people.